Hello, my name is Samantha Figueroa and I'm a nursing student for Seminole State College. Today I'll be doing the administration of medication by intramuscular injection. To do this, you have three sites you can choose from: the deltoid, the ventrogluteal, and the vastus loratus. For the first one, the deltoid, first thing you do is you grab your hand using 2 to 3 fingers, you go below the acromion process across the axilla, and the site is a triangular shape. So in that triangular shape, you do the injection. Next is the ventrogluteal. In that site, what you do is you grab your hand and you put it on the greater trochanterial, and then you put it here, and then with your thumb you point it towards the patient's groin. With your index finger, you put it over the anterior superior iliac spine, and then next, with your last 2 fingers, you put that along the iliac crest towards the patient's buttocks. And between that V shape, you put the injection site. Next is the vastus loralis. So next you do is you grab your hand and you put it over above the patient's knee, and then you get the other hand and you put in the greater trochanterial over there, and then in the middle is the site. The site extends over the midline top of the patient's thigh and the outer aspect midline of the patient's thigh. Today I'll be doing the deltoid intramuscular injection on Oscar Simpson. Alright? So next, what I'm going to do first is I'm going to clean my hands. Next thing I'm going to do is I'm going to look at the computer charting system. Next I'm going to find my patient, and I'm going to look at his date of birth, which is XXXXXXXX, and I see he's allergic to codeine and pollen. Okay? Next I go to the MAR, and I check to see what medication is scheduled right now. Okay, I see that he is scheduled for influenza vaccine. The dose is 0.5 milliliters once. The route is intramuscular. The start date is now, and it is for him. Now I'm going to go to the healthcare provider's orders to compare and verify. Okay, I see the same medication, I see the same dose, frequency, route, time, and the drug. Alright, since now we have that and we verified, now what we're going to do is we're going to grab the medication. Now that we have the medication, I'm going to clean my hand, and we're going to do the first 5 patients' rights. The first is Oscar Simpson is the patient. Next is the medication, which is influenza vaccine. Alright. Next is the dose, which is 0.5 milliliters in a 2 milliliters vial. Okay, and it's going to be done once, so it's going to be in a vial. Next is the route, which is going to be intramuscular. Next is the time it's scheduled for now. Okay. So now we have the drug, dose, route, time, and the person. Now the medication is already calculated. I don't need to calculate it. Now I do check for the expiration date. The medication is not expired. Alright. For patient education and for medication reference, I'm going to be using my IM pharmacology. The IM pharmacology worksheet. I cannot pronounce it today. I'm sorry. And on this worksheet, it will state why the patient's taking the medication, nursing implications, how I know the medication's working, and the potential adverse reactions. Okay. So now that I have that, now I'm going to calculate the medication. The medication is calculated. Alright. And now I'm going to determine where I'm going to do the intramuscular injection. I'm going to do the injection in the right deltoid of the patient's arm. The right deltoid can take about 1 milliliters of medication. The needle needs to be 1 inch, and the gauge has to be between 21 to 23. And I have to put the needle in the 90-degree angle, and I have to do a Z pattern when I inject the medication. So let me grab the needle necessary for the medication. Alright, it's a 22 gauge, and it's 1 inch. Alright, now that I have that, Now I'm just going to clean my hands once more time. Now when I look at this thing, I'm going to make sure that the integrity is good, it's not expired, it's not wet, it's not broken, it's in good shape. Alright, next thing I'm going to do is I'm going to do my second check off of my MAR of the patient's 5 rights. So like, again, the patient's name was Oscar Simpson. I'm going to go up here. Okay, Oscar Simpson. Okay, the drug is, it's a influenza vaccine. All right, the dose and frequency is a 0.5 milliliters in a 2 milliliter vial, and it's a single supplied dose, so we're only going to use this once. The route is intramuscular, and I'm going to do in the right deltoid, and the time is now. Since it's a single dose vial, I'm not going to put the time, date, or my initials. But if it was a multi-dose vial, I would. Alright. Now that I have that, I'm going to clean my hands again, and now I'm going to clean the vial and prepare for the medication. Next thing I'm going to do is I'm going to grab an alcohol pad. And next I'm going to open it. And I'm going to discard the cap in the trash can. And I'm going to clean it for 30 seconds. And then I'm going to leave it on top. Like I said before, I'm looking at the integrity. It's not expired, it's not wet, and it's not broken. Alright, so I'm going to clean my hands again. Okay, I'm going to open it. Okay, I'm going to discard of the plastic in the trash can. I'm going to move this back here. Now I'm going to make sure you guys can see what I'm doing. Alright, next thing I'm going to do is with the alcohol pad, I'm going to take it off and I'm going to discard it. And then I'm going to do a rainbow. There we go. And then this plastic, I'm going to put it on the table because I need it to recap the syringe. Next, I'm going to put in 0.5 air in here, as that is my desired medication dose. Next, I'm going to put it in here, and I'm going to put it in the center. I'm actually going to put it here because I want to make sure I don't strike myself or hurt myself or pierce my skin. I'm going to put air into air, and I'll make sure that I do not put any air into the fluid. I'm going to retract a little bit the needle because it is touching a little bit of the fluid, and I'll put air. There we go. Now that I do that, I'm going to put this in eye level, and then I'm going to tilt it a little bit so I can get the fluid in here. Move it back and forth so that I don't get air, and then tap it a little bit without trying to damage the syringe. There we go. Now that I got that, I'm just going to go back here, and then I'm going to make sure I have the cap, the passive right here. I'm not going to cap it in the air because I can potentially injure myself. So once I take it out, I'm going to go like this, and I'm going to slowly get it in there, in the cap. There we go. I make sure I do this without contaminating the syringe and contaminating the cap as much as possible, and I go like that. And now we have the syringe with medication. Next thing we're going to do is we're going to grab some tape, and we're going to put the medication. Right now we're going to put the patient's name, so we're going to put Oscar Simpson, the medication, which is the influenza vaccine. It is 0.5 milliliters once. I'll put today's date, which is November 11, 2020. The time was 1800, and then my initials. And I'm going to keep the vial because I'm going to need it to document the lot number and the manufacturer's number. So I'm going to put it together with the vaccine. going to tape it together. And next I'm going to put the hospital approved label onto the medication. Alright. Before I enter the patient's room, I'm just going to gather my other necessary supplies, such as a gauze for any bleeding, and more alcohol pads. Alright, and next I go into the patient's room. Can I come in?
Yes.
Hello, my name is Samantha. I am a nursing student. I'm here to administer medication by intramuscular injection, okay? Can I get your full name and date of birth, please?
Oscar Simpson, XXXX, XXXX.
Okay, can I look at your ID bracelet, please? Thank you. Now I'm going to compare that to the chart. Alright. And, Mr. Simpson, are you allergic to anything?
Codeine and penicillin. I mean, not penicillin, my bad. Codeine and, pollen.
Pollen, okay. And what type of reaction would you have if you were to take codeine?
Oh, headache.
Okay. And what type of reaction would you have if you were exposed to pollen?
Oh, my throat swells, I get itchy, red.
Oh, okay. I'll make sure that's noted in a chart. Can I look at your allergy band, please?
Yes.
Okay, comparing that to the chart. Okay, now to make sure that there's no clutter in the room, the bed is in its lowest position, the bed brakes are on, the bed rails are up, and he does have his call light. Okay. Alright, Mr. Simpson, the healthcare provider put an order for a influenza vaccination. From my understanding, you do live with a lot of family members in your own home, and the vaccine is to help prevent seasonal flu and reduce or decrease the symptoms of flu. Are you potentially allergic to eggs, Mr. Simpson?
No.
Okay. Have you ever taken the flu vaccine before?
Yes.
Okay, and what type of reaction have you had with the flu vaccine?
Nothing. It was good.
Okay, I'm just making sure. Alright, now that we got that. Okay, now I'm just going to make sure that the privacy curtain's closed and the privacy door is closed. Alright, now that those two things are closed. Alright, Mr. Simpson, I'm just here just to tell you that, again, I'm here to administer a influenza vaccine. It's intramuscular. In other words, it's going to be an injection through your right deltoid, okay? It is a quick procedure. It's just a 1-inch needle that goes in, okay? The injection can cause some soreness, tenderness, and warmness, okay? But it does help prevent seasonal flu and reduce symptoms, okay? So like I said, I'm gonna only put 0.5 milliliters in, all right? Okay. And this is a very common location for vaccinations, all right? Okay. I'm just going to clean my hands, and then I'm going to do my third MAR. So we're doing this. I'm just going to look in the patient's name, Oscar Simpson. Can I look at your, let me just clean my hands again. Can I look at your ID bracelet, please? Okay. Compare that to the chart. Alright. Alright, now the medication, now that I compared those. Okay, medication, influenza vaccine, 0.9 milliliters, dose 0.5 milliliters, it's in a vial of 2 milliliter vial. It's going to be, it's a single dose medication. The route is intramuscular, it's going to be in the right deltoid muscle, it's going to be, schedule is 1800, the time is 1800. Alright, so now we got the drug, the dose, the route, the time. Alright. Okay. Alright, Mr. Simpson, we're going to have you position. I'm going to put the headrest a little bit more up. Alright. I want you to relax your arms. Okay, I'm going to lower the bed rail. Okay. I'm going to clean my hands, and I'm going to put some gloves on, okay? Do you have any questions? No? No? Okay. make sure I open the woven gauze sponges just in case there's some bleeding. Alright, so like I said, Mr. Simpson, I want you to relax your arm. It's going to be a quick procedure, okay? Alright, take this off. I'm going to take off the tape. Actually, I'm going to use new gloves because that tape is a little contaminated. Alright, new gloves. And what I'm going to do is I'm going to do a locate the site. Doing so, I'm going to do 2 to 3 fingers below the acromin process across the axilla, and then the site is like a triangular shape, so should be like right here. Now that'll be the location, so I'm just going to move the claw bell. Now I'm just going to get the what's it called, the alcohol wipe. I'm going to clean in a circular from inwards to outwards. Alright, and I'm just going to leave it to make sure I know where last place I cleaned. Now, next what I'm going to do is I'm going to go rainbow, and then I'm going to put the cap here. I'm going to actually discard the cap in the syringe container. Next, I'm going to put a Z pattern onto the arm, holding like that. I'm going to move the alcohol wipe, and I'm going to go in gently and soft. Alright, Mr. Simpson, relax your arm. I'm going to put it in, and I'm going to slowly release the medication into the arm, slowly, no rushing. There we go. And then I take it out, and I put the safety on, and I put it in the syringe box, the dirty syringe box, and then I let go. Now that I've done that, now it's bleeding, so I'm just going to open the woven gauze. There we go. I'm holding it in so to stop the bleeding. Discard the paper. Alright, it's done bleeding. Discard this. Alright, now I'm going to clean my location. Okay. Alright, Mr. Simpson, how are you feeling? Does it hurt? Are you feeling any burning? How do you feel? I feel okay. Don't feel lightheaded or anything like that? No? Okay. Just making sure. I'm just going to clean my hands. Next thing I'm going to do is I'm going to document. I'm going to put the medication lot number, the manufacturer number. I'm going to put that it's Oscar Simpson, the drug, which was influenza vaccine, the dose, which is 0.5 milliliters in a 2 milliliter vial. The route was intramuscular it was intramuscular through the right deltoid muscle. The time it was given was at 1800, and yeah. So I got the drug, dose, route, and time, and I did. Now I also have to document also the patient's reaction towards the medication. Okay, I documented that. Alright, Mr. Simpson, are you comfortable? You are? Okay, I'm going to put the bed roll up, make sure the bed's in the lowest position, there's no clutter, you have your call light, the bed brakes are on. Are you comfortable? Yes? Okay. Next thing I'm going to do, I'm going to clean. Okay, now that I have documented the medication, I don't need the medication, it's a single dose, I can discard it. Okay. And I will make sure I open the privacy curtain and the privacy door, and I clean my hands, and I'm done.